As per one study, participants who lost 15% of their total body weight and have had diabetes for less than 4 years saw a 90% remission rate. 90% of those people were diabetes free at the end of study by losing 15% of their body weight. This is type 2 diabetes. So we do know weight loss plays a role when it comes to diabetes management. What role does intermittent fasting play when it comes to weight loss? Now, I've done a video specifically addressing the topic of intermittent fasting and weight loss. But when you're diabetic and you're trying to follow an intermittent fasting window, what are some of the things you need to look out for? Let's dig into this video and understand that. First of all, let's clarify what diabetes itself is. As much as we think diabetes is a sugar-based disease, so if you're eating a lot of sugar, you get diabetes. Diabetes is actually linked with something called intramyocellular fat. It's fat around your organs, around your muscle cells, which is not letting insulin do its job, which is causing high blood sugar levels. I've also further explained this in a 1 hour long video. You should see a link to the same in the description. Please go through that because I've made it very simple terms and very easy to understand what really diabetes is. Most people don't even understand what diabetes is, and I don't think the medical system does a very good job in terms of sitting and explaining the patient what they're going through. But once you watch that video and have a little bit more clarity in terms of what diabetes is, let's understand that fat plays a huge role when it comes to diabetes management. If you in fact just inject people with IV fat, you start seeing that their intramyocellular fat levels rise, their diabetes becomes worse, fasting glucose increases, HbA1c increases. And we have clients who we work with where we keep the fat intake in their diet to a minimum, and we start seeing all their parameters improve. Okay, so we have covered 2 points. Number 1, fat loss by itself can help you with diabetes remission, and number 2, injecting fat, eating fat can make your diabetes symptoms worse. Now, based on this, how do we bring the role of intermittent fasting in? Let's decipher 2 things: intermittent fasting and time restricted eating. Intermittent fasting is when you're deliberately dropping your calories by too much, and that's not necessarily always healthy. Time restricted eating is you're restricting your eating window within a certain time. Now, if you're a diabetic and you're also taking medication, and you start working with a nutritionist to get on a healthy eating plan, and you adopt intermittent fasting, everything together, then your body starts responding. Your body wants to heal, so it's going to start showing results very, very well. But if at the same time you're not working with your doctor to slowly start tweaking your medication dosage, you'll start noticing that while intermittent fasting, you risk getting into hypoglycemia, which is blood sugar dropping too low, and that can lead to nausea and even coma in worst cases. And that's a very put off, right? So let's say you were trying to do intermittent fasting and you start feeling giddiness and nausea, which is a very common symptom because your blood sugar, you're taking medication to manage your blood sugar levels, and now it's suddenly too low. You don't want to try intermittent fasting again because in your mind you have this negative association, negative symptoms that happen to you. So it's very, very important, first of all, if you're diabetic, to work with an expert to slowly tweak your medication dosage, and especially if you're on a healthy eating plan, because when you're on a healthy eating plan, you will start seeing better results and faster results. The second thing is exercise. If you're following an intermittent fasting window, and depending on how high dosage of medication you're taking, avoid exercising empty stomach, because exercising is burning your sugars. It's burning your body's glycogen stores, and that can also put you in hypoglycemia, and it can be very, very dangerous for you. An important metric to track here would be your fasting glucose. Just get a glucometer at home. You don't need a CGM device unless you are type 1 diabetic. In fact, I don't promote CGM devices because it can give you a very one-directional picture, and you start avoiding a lot of very healthy foods because it's rising your blood sugar level, which should happen. But just track your fasting glucose at home. Get a glucometer at home, and at least 3 times in a week, track your fasting glucose. Keep a note, maintain a chart, and this is easier when you go back to your doctor because they can see your progress on a weekly basis and start tweaking your medications very, very slowly, which is helpful to you. But intermittent fasting does play a role when it comes to diabetes management, particularly when done properly, particularly when you're eating the majority of your calories in the first half versus the second half. If you're sleeping as per a healthy circadian cycle, meaning you're sleeping as close to sunset as possible, waking up as close to sunrise as possible. So let's say you're sleeping between 9-10 p.m. and waking up at 5-6 a.m. That is the most ideal for your body. You're making lifestyle changes, including a little bit of resistance training, all of these can play a factor. Let's now discuss how do you break your intermittent fast. So let's say you're a diabetic, you've started to incorporate intermittent fasting. What should be the first thing you eat? Well, avoid foods for the first 45 to 60 minutes of waking up if you're a diabetic. Otherwise also, because your body is not very prone to digest food. Your digestive enzymes are just beginning to work. Your sleep hormones are just beginning to go down because you've just woken up. But after the first 45 to 60 minutes, start your meal ideally with a complex carbohydrates, which could be whole grains. If you're South Indian, then pongal is a great option. Pesaretto is a great option. Anything made with brown rice is great. Anything made with whole wheat is great. And add a protein source to it. Lentils, pulses are a very, very good option. A chutney which has pulses, like a horse gram chutney or dal chutney, is a very, very good option. If you're North Indian, then some of the options are missi parathas are a really, really good option because you have your lentil and your grain source in it. Making a healthy version of poha with red rice and also adding some pulses, sprouts is a great option. Stir-fried mung or mung sprouts is another fantastic option. But the combination of the complex carbohydrates with a little bit of protein coming in from pulses or lentils, tofu, tempeh, if you like the taste of it, is a fantastic option to add. Add a little bit of fruits. If your HbA1c is very high, then stick to low glycemic index fruits. If it's not very high, then sticking to any fruit of your choice. Bring in a lot of diversity though. Don't repeat the same fruit on a daily basis, because more diversity, better your gut health is important. But start your meal about 1.5 hours later. Don't eat anything immediately after waking up, and do a combination of complex carbohydrates, proteins, and then a little bit of fruit on the side. Now, how much you eat, what exactly should you eat, is obviously very person specific. Depends if you're having an activity level planned around, if you're mostly sedentary, how's your mental health, how's your stress levels, because this is also activity, right? So if you're busy in work, you're mentally active, you are burning calories, you are active. So you want to plan your food around that and work with an expert in terms of understanding what is right for your body type. I did mention pulses, and pulses are very, very important, especially if you're a diabetic, because pulses have something called a second meal effect. The second meal effect is, let's say I've had pulses for breakfast, then my blood sugar response to the meal I'm having next, which is lunch, is blunt. Meaning, let's say I had chickpeas for breakfast. Now, even if I have an ice cream for lunch, my blood sugar spike is not going to be as much as it would be if I hadn't had the chickpeas. This is called the second meal effect, and it's very fascinating. Especially for diabetes, I do suggest a handful of pulses or lentils with every single meal, because that helps you control your blood sugar spikes. And blood sugar spikes are what also causes energy crashes. So every time you have a spike and a drop in blood sugar, you're hungry, your cravings are high, and to make sure that it stays pretty stagnant, adding pulses can make a huge difference. Let's discuss some superfoods for diabetes. One of the easiest inclusion is kalonji seeds or onion seeds. Kalonji seeds in various studies have shown to have an impact in your blood sugar level and even your HbA1c. Such a simple addition. You don't have to do anything else but 1/4 of a teaspoon of kalonji seeds. 1/4 of a teaspoon, the small spoon, 1/4 of it, that's it. That much per day can have an impact. If you're having sabzi, soup, salads, anything, just sprinkle it on top and put it in a salt pepper shaker and keep it on your table, on your dining table, so you don't forget. It's very easy to include it on a daily basis. This is a lifestyle change. Now, me telling you and you including it for the next few weeks and then forgetting about it, that's not lifestyle. But if it's in the salt and pepper shaker and it's in your dining table, you're not going to forget about it. And that's a lifestyle change. The second interesting superfood is amla. 1 amla per day. In fact, for especially cholesterol, amla it acts as well as certain drugs too in terms of reducing cholesterol. Amla also helps with blood sugar spikes, and having 1 amla per day is not very difficult. If it's not in season, I suggest making amla pickle and having a tablespoon with your lunch, something you're not going to forget. And if it's in season and you're getting not so sour amlas, then having 1 boiled amla per day around your breakfast or lunch or in between your meals. If amla is causing loose stools, it's okay. It is a cleaning agent. It is slightly laxative. And if it's not bothering too much, it'll settle down. Your body will get used to it, but don't stop amla for that. Number 3 is banana stem, especially if you live in the south. You get banana stem very easily and pretty much year round. And banana stem raita is one of my personal favorite recipes and a usual rotation at our weekly rotation at our home menu. And banana stem raita is relatively easy to make. You're getting the probiotic benefits of the yogurt, and we use a peanut yogurt at home. And you're also getting the diabetes management properties of the banana stem. Banana stem is very rich in potassium and has certain enzymes that helps you with insulin spikes. So make this a 3 to 4 times in a week. Make it an inclusion in your diet. I have written a detailed blog on diabetes management, recipes for diabetes management, and we often have seminars and workshops helping people understand what causes diabetes and how do you reverse diabetes. More about the same in the link in the description below. Please check it out and pass it to a friend or family member who might benefit from it. This is Roshni Sangvi. I'm a registered holistic nutritionist.